Welcome, everyone, and good evening. Thank you for joining us for our free webinar, Prostate Ablation Treatment for Prostate Cancer with Anup Vora, MD. Dr. Anup Vora is the Clinical Director of Prostate Cancer Focal and Ablative Therapy at Chesapeake Urology. He practices general urology and focuses on urologic cancers. Dr. Vora completed his fellowship in urologic oncology at the preeminent Cleveland Clinic, Florida, and specializes in the treatment of prostate cancer, including primary and salvage surgery for complex cases, also bladder and kidney cancers. He received certification in the principles and practice of clinical research from the National Institutes of Health and received the highest score distinction from Georgetown University Hospital Department of Urology. He was a Research Award finalist with the MedStar Research Institute at Washington Hospital Center and a member of both the Cancer Committee and the Education Committee at Georgetown University Hospital Department of Urology. He is a member of the American Medical Association, Association of American Physicians and Surgeons, the American College of Surgeons, the American Urologic Association, including the Mid-Atlantic section, and the Endo-Urological Society. I'd like to welcome Dr. Anup Vora.
Thank you so much for the introduction. I'm glad everyone is on the webinar here today. Give me a second. I'm going to share my screen and we'll get started. The topic for our discussion today is prostate ablation as a treatment for prostate cancer. Now, what prostate ablation is, how we treat it, I'm going to go into all those details today. I'm Medical Director of Focal Therapy and Prostate Ablation here at Chesapeake Urology. I see general urology patients and I specialize in urologic cancers as well. So unfortunately, 1 out of 7 men will be diagnosed with prostate cancer in their lifetime. Men, when they're faced with this diagnosis, they have to choose between generally 2 options. Is this a cancer that I want to watch, or is this something that I can treat? And if they treat this cancer, usually men will choose something like surgery or radiation, which typically is a invasive radical treatment. Now, surgery and radiation do a very good job of curing the cancer, but there are side effects. And so when men are deciding whether I want to watch the cancer or treat the cancer, a lot of this comes into play. There are some cancers that we really cannot watch, and sometimes men don't want to watch the cancer. And so if you look at the treatment side effects of the different types of therapy, the main ones we'll focus on are the loss of urinary control, which can happen with surgery or radiation. Urinary control is important. It helps us stay dry. Men who have loss of control can leak urine, and that requires them to wear sanitary pads in their underwear, pull-ups, or diapers even. So that is a major side effect of these treatments. Additionally, erection, our sexual function, is an important part of our quality of life, and prostate cancer treatment has the negative side effect of impacting the sexual function, and some men lose it completely. Hearing these side effects, men sometimes feel, hey, let me just watch the cancer, and that's appropriate. While men are watching cancer, about 30% of the time, the cancer grows, becomes more aggressive, and mutates into a cancer that's not safe to watch. And some men are faced with a psychological burden, we call it, when they're on active surveillance. When they're watching the cancer, they really worry about the cancer progressing, and they really are better off having it treated so they get that peace of mind. Prostate ablation is a treatment option that's kind of the best of both worlds. You get to treat the cancer, but we minimize the side effects. It's an alternative treatment that does not require any incisions. So there's no incisions like surgery. There's no radiation either. Prostate ablation treatments have the potential for less side effect. Now, it also allows for something called focal therapy, and I will talk about this in a couple minutes in a later slide. Prostate ablation can utilize different technologies. Currently, HIFU, which is an ultrasound energy used to heat the prostate and destroy it, is a technology we can use for ablation. And cryotherapy, which is a freezing technology where needles are placed into the prostate and gas is run through the needles. And if you think of something like liquid nitrogen, it's very similar, where the gas becomes very cold and those needles freeze and destroy the prostate. That also is a technology we can use for prostate ablation. There is quite a bit of research going on in experimental treatment, such as laser, steam, electricity. These are all options that men can utilize to ablate the prostate, destroy the cancer, and have less side effects. The procedure itself, not to become too graphic, but the procedure itself is very similar to the prostate biopsy that is used to diagnose prostate cancer. So we insert a probe in the rectum, and that probe is used to visualize the prostate. When we visualize the prostate, we see it as this kind of a ovoid circular shape in the center of the screen. The prostate, when we see it in real time, allows us to use the ablation technology to destroy parts of the prostate where there's cancer. And so this allows us to be very safe and precise in how we deliver the energy to destroy the cancer, so we minimize those side effects. Prostate ablation procedures are outpatient. There's no hospital stay required. This is important during this COVID-19 crisis because this keeps patients out of the hospital. There's little to no pain. And while every procedure can have side effects such as infection or a temporary urinary obstruction, the risk of urinary incontinence and the risk of loss of sexual function is very minimal with prostate ablation. Just like any procedure that we do for prostate cancer, we do have to monitor the prostate and the PSA to make sure that we have surveillance to make sure the cancer does not come back. I referenced an earlier slide where patients had to choose watching the cancer, surgery or radiation, but now there's an option that's in the middle called prostate ablation. One thing I alluded to earlier was focal therapy, and I want to briefly mention what that means. Focal therapy is the treatment of a part of the prostate as opposed to the entire prostate. Generally, when we talk about surgery or radiation, those treatments treat the entire prostate. They're not able to focus on a small area. And there are some men who have what we call multifocal cancer. Multifocal prostate cancer is where cancer is found on multiple different parts of the prostate. And you can see in this picture, the areas that are circled red are the areas of the prostate where the pathologist found the cancer. And so in a patient like this, where the cancer is all over the prostate, that patient needs a total prostate treatment, whether it's prostate ablation for the whole prostate, surgery, radiation. The entire prostate needs to be treated to make sure we adequately get all of the cancer. There are some men, however, who just have a small area of prostate cancer. And for these men, it doesn't make sense to treat the entire prostate. Instead, we could do a focal prostate treatment. And what that means is we treat just the area of concern. For example, in this slide, just the circled areas of the prostate in red and green. And we can treat those areas with a small safety margin to ensure that all the cancer is treated and we minimize side effects. Men will sometimes ask me, why shouldn't I treat the whole prostate? Why do I need the prostate? Or why should I just treat the part of the prostate that's affected by the cancer? And the reason is, it minimizes side effects. Patients who are good candidates for focal therapy are those who have positive biopsies in a small area of the prostate, patients who have a small number of positive cores of prostate cancer. And generally, we prefer men who have smaller prostate sizes and men who have lower risk cancer or lower Gleason score cancer, because it really works well for those patients. There are different technologies we can utilize for focal therapy, but primarily it's the same technologies as prostate ablation. HIFU, which is ultrasound energy, and cryoablation, which is freezing energy, can destroy the prostate in a focused manner. There are applications for focal radiation, and they're doing a lot of research of other technologies as well. One unique advantage of focal therapy is we can personalize the treatment, and this is important. Every single man is different. Every single man who has prostate cancer is different goals, different areas of cancer. And so with focal therapy, we can tailor the treatment to the patient. And so an example of this is on the slide. We have 3 different prostates. Each patient has a different area that's positive for cancer. And what we can do with focal therapy is utilize the technology because it is refined enough now that we can just target the area of concern with the safety margin and adequately treat all the cancer for that patient in a very personalized fashion. So if a patient has cancer in just one area, we can focus on that area. If they have cancer in two areas close to each other, well, we can get all of that, but leave the majority of the prostate alone. So this is truly a personalized treatment, which is more appropriate with the use of the technology in the 21st century. Now, ultimately, why would someone choose focal therapy? If you treat less prostate, there's less risks. There's less risk of erectile dysfunction. There's less risk of urinary incontinence, which is leakage. Every procedure has side effects, and so there's small risks of infection, small risks of obstruction in passing the urine, which is generally managed with a urinary catheter. In the end of the day, there's less risk of erectile dysfunction and incontinence. So this is why focal therapy is a great treatment. Now, it does require surveillance. So just like any treatment for prostate cancer, we monitor to make sure that the treatment has worked and the cancer has not recurred or has come back in any other part of the prostate. So it definitely requires us to be monitoring that. I'm going to answer two questions that came up just now. I'm going to answer them because it's relevant to kind of this slide. So it's a great question is what happens to the dead tissue of the prostate? So let's say we are treating the prostate and we ablate it with these technologies. If you look at the area of the prostate that is treated, what happens to it? Well, ablation destroys those cells and it essentially becomes scar tissue. It becomes fibrous with the capsule. If we treat the whole prostate, because patient has multifocal cancer, the whole prostate just shrinks and becomes a scar. And if we look under a microscope, the tissue is completely destroyed and there's just some collagen fibers and inert material there, but there's no living tissue. Now, the exception is that with prostate ablation and focal therapy, we avoid the critical structures. The critical structures are the urethra, which is the drainage tube that drains the bladder, that runs through the prostate. We are able to avoid that structure, and so that structure remains viable. The nerves that control erections sit alongside the prostate. Those nerves are preserved, so the tissue around the nerves are healthy, and they're as if they have not been altered or touched or interfered with. So it preserves what needs to be preserved, it destroys what needs to be destroyed. Another question, a very good question, is we mentioned earlier that we prefer patients with lower risk, lower grade cancer, smaller prostate sizes. But what are the limitations? Well, it's a case by case basis. If we were to treat the whole prostate, generally around 40 to 60 grams, which is the unit of measurement of the prostate, is our limitation. But we do have medications that can rapidly shrink the prostate to allow treatment. So it's flexible, 40 to 60 grams, but we do have the option to shrink the prostate. Bigger prostates can be treated, but usually only in a focal setting. So if we see an area of cancer in one spot, we're able to utilize our technology to treat that spot, even if the prostate's very big. This is especially useful for patients who have had an MRI and have been diagnosed with cancer after a MRI-guided biopsy, because we know where their cancer is. We can put a needle right into that area of cancer and destroy it. Any Gleason score could be a candidate for this. The reason we prefer lower risk and lower grade cancers is because if you look at the studies show that prostate cancer that is lower in grade is less aggressive and is more likely to be destroyed with these technologies. The higher grade cancers are more aggressive. The treatment can sometimes not be effective. And so we definitely counsel every individual patient on what their specific score is and what the success rates would be for that particular patient. How can you proceed? The key is to talk to your urologist. If you have been diagnosed with prostate cancer, if you're on active surveillance, you have regular visits with your urologist. You can reach out to them sooner, or you can talk to them at your next visit, and you can say, am I a good candidate for ablation? And they'll communicate that with you. And if they aren't sure, then they'll ask me or one of their colleagues, and we'll get that information to you. If you reach out to us at ChesapeakeUrology.com, you can schedule an in-person or virtual visit. And I think at the end of the talk, my contact information will be there. So at any point, if someone is interested, if they're a candidate, then we'll definitely be able to screen them to see if they're appropriate for prostate ablation or focal therapy. We have some great questions coming in. Can I be contacted on the portal? I can be, but they only allow patients who've seen me before to contact me directly. So the best way is either to reach out to your urologist or to schedule a virtual visit where we can discuss your specific situation. Does HIFU involve a needle? So that technology, HIFU, does not involve a needle. The way HIFU works is all the energy is delivered through a probe that's in your rectum, similar to how we look at the prostate and do a prostate biopsy. We insert a probe in the rectum. That probe sends the energy through the rectal wall. Each sound wave does not have a lot of energy, but where all the sound waves meet, the tissue heats up very hot and destroys it. So that is a great question. Would it be possible for a heart transplant patient to have it? Great question. That's a very good question. So all of these procedures require anesthesia. And so if a patient has a heart transplant and is going to undergo anesthesia, sometimes there's certain cardiac risks that are involved. So often the transplant center that that patient goes to wants to know where are they having the procedure. And often they want to keep those patients close to them in-house. So prostate ablation could very well be possible, maybe at the center where the heart transplant treatments are. At Chesapeake Urology, we do things in our outpatient center, and we have certain anesthesia guidelines. And sometimes heart transplant patients may not meet criteria, but I'm not an anesthesiologist, so I wouldn't be able to say yes or no. We have patients check with their transplant doctors first. Can the treatment be combined with therapy such as radiation, hormones, or surgery? That's a great question. HIFU, cryotherapy, prostate ablation can be utilized after a other treatment has failed. So for example, if someone's had radiation and the cancer has come back, well, we can give that patient prostate ablation and try to cure their cancer. So it can be used in conjunction with other therapies if they didn't work, but typically we don't do both at the same time. And the reason for that is each treatment is supposed to be effective themselves. And if we do too much, then we increase the risk of side effects. And one of the goals of all these treatments is to minimize the side effects. At what PSA level should we have concerns? That's a great question. It's dependent on each individual patient. So some men may have stable PSAs that are high. I wouldn't be worried about it. Some men have PSAs that are rising. That's what I would worry. If someone has had treatment for prostate cancer and their PSA is rising, well, it depends on that individual patient, what their age is, other health conditions are. So I wouldn't say that there's a specific level. I just think that every patient has a different criteria, and we would be concerned or not. The Red Cross does not want blood from people with cancer. Does this include prostate cancer? Possibly. You would always want to the Red Cross related guidelines. So if they exclude anyone with cancer, then they probably exclude prostate cancer patients as well. Another question I have is, how is it decided what procedure to use, HIFU cryotherapy? And I'll answer this question along with another one that I think I left unanswered was, do insurances cover these procedures? HIFU has certain advantages. Cryotherapy has different advantages. There are pros and cons with the patient. Ultimately, patients are candidates for both, but the subtle differences between the two, the patients can decide if they prefer one or the other. Now, cryotherapy has generally always been covered. HIFU, up until recently, has only been partially covered by Medicare, but that is all to change in 2021, where it will be fully covered. That's the anticipation. So in short, yes and no. Historically, no, but moving forward, absolutely. We expect both to be covered completely. Anesthesia requirements for the procedure. And I apologize, I should be reading these questions out loud so that everyone can get the full breadth of it. But the question I received is is general or local anesthesia used for HIFU? The answer to that is general. For any of these procedures, we typically use general anesthesia. The reason is we want the patient to be comfortable, and we don't want the prostate to shift during treatment, because then it could mess up the precision that we use with these technologies. Can the procedure be done after brachytherapy? If someone has brachytherapy, which is a type of radiation for prostate cancer, and the cancer has come back, sure, HIFU or cryotherapy can be used to destroy the prostate and try to cure the cancer if the cancer has come back. Some patients may have met with their urologist and they may not have had prostate ablation being discussed to them. Prostate ablation is an option that's relatively new. Not all urologists are comfortable doing them or even talking about them. And that is the reason we're here today, to educate patients. Behind the scenes within Chesapeake Urology, I'm educating our doctors that they know all the options available now. So it's never too late to have the consultation. So I think if anyone is considering a type of prostate treatment, but they would want to consider prostate ablation, they should just reach out to their urologist and say, I was at Dr. Vora's webinar. I want to learn more about prostate ablation. And usually they reach out to me, and we take it from there. You can also directly schedule a visit, virtual or in person, and we can talk about whether or not that patient is a candidate or not. I really appreciate everyone logging on, because it's important that we educate ourselves and advocate for our own health benefit. And, I want everyone to know about prostate ablation. Whether you choose surgery, radiation, surveillance, I truly feel that if you're in your urologist office, you're going to get good care and you're going to get good treatment. We just want everyone to know what options are available. And to some men, ablation and focal therapy may be a great choice. Other men, it may be surgery, maybe radiation. But to all patients, we strive to excel and treat them with the utmost care. Oh, I'm sorry. One last one. When was prostate ablation introduced? It's been around since the 80s. Cryotherapy has been used in the 1990s. HIFU was developed in the late 90s and has been used in Europe for a long time. It's only now FDA approved recently in the United States. So we're now doing it. It's been around for a long time, and we're happy to bring it to Chesapeake Urology. Currently at Chesapeake Urology, I'm the only doctor doing HIFU, but we have 3 or 4 doctors who do cryotherapy. So if you talk to your urologist, you'll be able to get plugged into a doctor near you. But I'm always available to help with patient care. Does the surveillance of the treatment involve biopsies? It depends. Normally just PSAs and MRI, but if there's any cause of concern, we sometimes do perform a biopsy to make sure the cancer has been cured. But we typically don't do a knee-jerk biopsy on everyone unless we discuss that ahead of time. And I'll repeat, HIFU is high-intensity focused ultrasound. It's ultrasound waves that heat the prostate and destroy the tissue.
If they have ablation treatment, would the man go home with a catheter after this treatment?
Yes. One of the side effects of prostate ablation, whether it's the whole prostate or a small part, is that the tissue swells. When it swells, it blocks off the urethra, and the bladder has a very difficult time draining. So what we have to do is insert a catheter. Now, the catheter could be through the penis, the standard catheter that you may have heard about. The other catheter that we sometimes use is a catheter that's directly through the abdominal wall into the bladder. It's called a suprapubic catheter. And that sometimes is a little bit more comfortable because it keeps the penis free of any type of tube. But both catheters would be an option for a patient after an ablation procedure, but a catheter would be necessary. That's a great question.
And last question, would you please repeat what HIFU stands for?
For sure. HIFU is HIFU, high intensity focused ultrasound. So we use ultrasound energy that is at a high intensity, and we focus it on an area of the prostate that we want to treat. It's very precise and destroys the tissue.
Okay, thank you so much, Dr. Vora. Thank you, everyone, for joining us this evening and for your great questions. To make an appointment or to get more information, please visit us at ChesapeakeUrology.com. Dr. Vora sees patients in Chesapeake Urology Silver Spring office and also by telehealth visit. Thank you once again and have a great evening.